We're here today talking about wireless radiation and health, and I think we are in the midst of a paradigm shift, which we'll know better once it's already completed, insofar as there is a revolution in understanding the body electric, and the fact that the body is electric, that we live or die by virtue of having a heartbeat and a brain that works, and therefore the question is, what is the role of other factors that affect the body? And we're going to talk about the big picture here. I will tell you that I think as Richard alluded to it, risks are bigger than you might imagine. That is certainly the case from the National Toxicology Program study that we're going to hear about, and from work being done in Italy as well. The second thing, though, is that benefits can be stranger than you imagine. And here I have in mind some of the radical applications of medicine today, some of which are taking place here at Hebrew University and in institutions around Israel as well as around the world, in terms of using electricity in medicine to do all kinds of things that you might not have imagined even a decade ago. And finally, the solutions are, in fact, easier than you think. So I want you to keep that in mind as we go through this this evening and talk about what we can do here today. I also would be remiss if I did not acknowledge my partner in crime here, Chuck Greenblatt. Chuck, can you stand for a round of applause, please? Thank you. Chuck I could not have done this without him, and he's been incredibly helpful, and it's really a distinct honor and a great pleasure to work with you and the people in this room. I'm continue to learn a lot. It's important to be recognized. We're in an institution that was founded by Albert Einstein. Right? This has a long and respected and amazing history, and we face the challenge of a famous Indian parable of the guys in the cave, each of whom is blind, and they're feeling a different part of the elephant. And we all tend to focus on that different part of the elephant that comes from our discipline. But one of the many lessons from that parable of the guys in the cave who are all blind is that they had to combine all their information to get the whole elephant, and no one of them alone was correct. And I think that's a useful message for us to think about as we begin this expert forum. Many of you are aware, but I want to just make sure you all know, that the World Health Organization issued a report in 2011 and said that wireless radiation from cell phones was a possible human carcinogen. Okay? Now that happened several years ago, that classification. Several people who were in that monograph are in this room today. So the classification as a possible human carcinogen was not something that was whimsical. It was only made after serious review of the literature at that time. And the question we have to ask ourselves here today is, do we have any new information that would suggest that we classify cell phone radiation differently than we did in 2011? And I think the answer is yes, but we're going to look at that. One of the things that we have to unfortunately acknowledge is that that is the way cell phones are tested today. It's an empty bowling ball, basically a big plastic head, and a computer goes into it and looks to see the simulated temperature that might happen to avoid getting hot after 6 minutes. Now, that was the standard that was set back in the 1990s, when it was assumed that the average phone call was short and the average person making that call was a military user or a medical person. Obviously today, with millions of children, infants, and toddlers using phones, that assumption is no longer warranted. What we do know, unfortunately, and I want to show you these, this is what children are doing with phones today. And in case you don't really believe that, pass this around the room. This is a teething rattle case for an iPhone. I'm not making this up. That's the iPotty, and there are some young children who will not go to the potty without their iPads, just like their fathers. Yes, I see some, right. But this is an amazing thing I want to share. Look, an iBouncy chair. They say when they advertise this that you can put the baby there and you don't have to look at it for hours. Right? It's amazing, right? So this is a problem. And whether or not there's a health hazard to this, the idea that you want to leave your infant unattended and questionable. You know, you get such a short period of time. When my daughter got married now 5 years ago, I felt like she'd just been a baby, 10 years earlier. They go from being a baby to getting married. It feels like it happens very quickly. So, as speaking of my daughter, there she is. And you can see in the same exposure to the sun, she is here with her daughter, who obviously needs protection from the sun because of her fair skin, her blue eyes, her red hair. So identical exposure results in different biological consequences depending on a lot of different factors. And this one here, I think, is an excellent illustration. You can have the same exposure to sunlight, and one could get damaged, burned, and the other could be perfectly fine. Now let's look at what goes on with radiation. This work is being done by our colleague Claudio Fernandez in Brazil's National Federal University of Porto del Sul, where the laboratory is working at 1 millimeter resolution in modeling of the brain that comes from the virtual family, which you're going to hear about later tonight, was developed by Dr. Neufeld and his colleagues at ITIS. And what Claudio has done is to show that this here now, the yellow and white, is the higher exposure, greater absorption. And you can see there's more into the child there than into the adult. That is to say, it goes all the way through both eyes, as in the child, all the way into the full cheek, through the nose, as opposed to in the adult. This image comes from a 2015 paper showing the near field exposure from just a child looking at a tablet, right? And there already are reports, not just of eye strain, but of eye problems in children who are spending lots of time in front of screens. And this exposure modeling that was done here was looking at just a 1 gram cube of tissue. And that's relevant because whether you use a 1 gram cube or a 10 gram cube, you can get different amounts that will be absorbed. And there are 2 different standards in the world today, one of which does use the 10 gram cube for much of Europe. But this is a realistic, anatomically accurate model of a child made from an MRI. And what we see here is clear evidence that there's exposure going well again into both eyes. Now, this is a simulation that was done of a laptop on a lap. Now, they don't call them laptops anymore. They call them tablets. They belong on tables. But in fact, if you watch here, again, this is showing the exposure as it's moving into the body from just the normal use of a laptop, which has usually at least 1 or 2 antennas on the laptop. And it's the antennas that are sending and receiving the radiation. And we obviously are concerned about the long-term impact of that kind of exposure. The second here I will show you is from virtual reality. Now, the virtual reality, have any of you used a virtual reality device? Yep. Okay. Well, here's one that was being marketed to 8-year-olds, okay? And they can hold it right here, and they can take a trip to the moon. Let me pass this around if you want. And it holds a smartphone that is emitting and sending and receiving wireless radiation. And they have never been tested. They've never been tested for their exposure or for any safety limits at all into the young brain with a thinner skull which contains more fluid, and leaving aside the social, cultural, and other factors that one might want to be concerned about. The greatest exposure clearly occurs in the last month of pregnancy when the fetus is right, the abdomen is full, and the fetus, and the spine is right here, and the head is right there. We have a new demonstration of that from Dr. Leon and his family. And we know that the skull of the newborn is going to be very fragile. They don't break when we drop them, unfortunately. That does happen from time to time. But their skulls are so much thinner. And their brains are not fully myelinated, and therefore they're not being protected. Now, I will show you this last one, which Claudio has done very recently. And this is showing that the greatest exposure in the human body that we know of occurs into the penis and the testicles, which are entirely fluid. And this is a simulation of that exposure that will take place in dose into the bone marrow. And the dielectric constant is what determines this exposure. Now, the dielectric constant of the air is 1. The dielectric constant of our brains is about 30 to 40. The dielectric constant of a child's brain may be 60 to 80. And the dielectric constant of a male's reproductive organs is extremely high. And because of that, they're going to get much, much greater absorption. And now the consequences of that absorption, we're going to hear about from Hagai Levine tomorrow. Tomorrow, yes. Okay, is very simple. There are many studies now that have been done in 8 different countries, some of the top institutions, the Cleveland Clinic, National Laboratory in Australia, all showing the same results as we have here. And what this is that this is a measure of vitality and motility, how well sperm can swim, and this is a measure of DNA damage or mitochondrial DNA damage on the sperm. And so when sperm are taken from one man and put into 2 test tubes, and one test tube is exposed and the other is not, the test tube that is exposed to the cell phone radiation for 2 hours will have sperm in it that die 3 times faster with 3 times more damage on their mitochondria. And this is clearly showing a serious problem. Now, you know that you need about 500 million sperm ideally to make a healthy baby. And the reason we've recently discovered is because sperm don't know how to ask for directions. Now, maybe in Israel they do, but not in most countries. Now, the National Toxicology Program recently released these results, and I want to make sure, Linda Birnbaum has authorized me to say this. This is not a preliminary report. This is not a incomplete report. This is a final analysis of the brain and heart of the rats in this study. And this report was released in May. It is the largest, best designed study ever done that found increased rare malignant cancers in rats exposed to cell phone radiation, and not a single one in controls, and you'll hear in a moment from Dr. Melnick why that is so important. The animals were in shielded chambers. Both the controls and the exposed were in shielded chambers. And the exposures were comparable to 36 years of half an hour daily from currently used phones. There were about 3,000 animals. This is the largest, best designed study ever done, and it is a final report. Contrary to what industry has said, how it's preliminary and we have to wait for the results, there's no waiting. These are the final results. They're not going to change. The results went through the pathology working group, which means that they were triple blinded reviewed, and they also had external peer review. Dr. Birnbaum wanted me to make that clear to all of you. It's been through extensive external peer review. And the schwannoma of the hearing nerve was increased. In humans, the schwannoma of the heart is increased here, and we'll hear from Fiorella Belpogi how important that is. Now, just to put this in context, this is a recent French case control study of humans. Okay, we went from the animals to the humans. And here you see that after 836 hours of use, of reported use of the cell phone, there's an increased risk of gliomas and meningiomas. And between 327 to 835, there's also an increased risk of glioma. This is 147. This number here is almost 2.8. That is to say, 2.8 times more malignant glioma in this study. Now, what's important is that this study was consistent with a number of other studies, all of which have found that once you reach either 10 years of use or this many hours of use, there tends to be an increase in brain cancers. Finally, when I said that some of the benefits are amazing, we will hear about some of them tonight from Dr. Lieberman and Dr. Neufeld. There are many growing medical uses of non-thermal RF. And I would submit to you that these medical uses, whether it's laser therapy to stimulate bone, or whether it's treating cells to enhance the uptake of chemotherapy by weakening membranes, all of these medical applications are evidence that there are biological effects of non-ionizing radiation. And some of these applications, of course, are using high levels, but many of them are using extremely low levels of alternating current, as we will hear. So the American Academy of Pediatrics in the United States has called for reevaluation of RF regulations, and recently, after the NTP report came out, the American Academy of Pediatrics issued 10 safety tips to reduce radiation, which in fact come from a lot of the things that are on the Environmental Health Trust website as well. Several commercial insurance firms around the world will not cover damages from electromagnetic fields. This is not widely known, but it's an important thing to think about when we talk about setting standards for public health. The insurance industry won't cover these damages. This industry is so profitable that it covers its own. It self-insures. But this is a sign, I think, that since they've excluded coverage for EMF-related things, obviously there's a reason for that concern. Finally, I'm pleased to tell you that there's a growing movement in a number of countries for the right to know. The right to know about cell phone radiation has been passed by the city of Berkeley, and it's being defended by Harvard professor Lawrence Lessig, who is working with us in a number of places to support this. It's gone through court challenges from industry, which claims it's a violation of their First Amendment rights, and to compel them to tell this. It's recently been introduced in the state of Massachusetts by State Senator Julian Sir. It will be defended again by a team from Harvard and Yale, and it's a very modest statute. It simply says, tell people they have a right to know. Let them make decisions once they have that information. So Argentina, we will hear from Sergio Bergman shortly, who is the Minister of the Environment, who's unable to be with us this evening. They have also introduced, with his endorsement, the need for research and policy on environmental health on non-ionizing radiation. Now, I want to share with you something that we've done as an example of some of the simple ways you can educate people. This takes 30 seconds.
That's me, Serena Scott. When I ski or ride my bike, I always wear my helmet. Whenever I talk on my cell phone, I use speakerphone or a headset for the same reason, to protect my brain. Cell phones really are small microwave radios. Young adults' brains are still developing and are much more susceptible to radiation. I'm not going to stop using my cell phone, but I want to use it safely so that nothing gets in the way of my fun. Oh, I'll text them back.
And that 30-second ad has run in a number of places in movie theaters, and it's a very simple way where we'll hear from our colleagues from Cyprus about other information that's gotten out, just to tell people a lot has happened in the 7 years since this public service announcement was made. And one thing is that the young woman who was in there, who's with us here tonight, has graduated now from Tufts University, magna cum laude. Now, I'll leave you with this thought from Albert Einstein. The world is not dangerous because of those who do harm, but because of those who look at it without doing anything.